IBR and CBR, institutional based rehabilitation and community based rehabilitation. Rehabilitation. According to WHO, rehabilitation is as a set of measures that assist individuals who experience or are likely to experience disability to achieve and maintain optimal functioning in interaction with their environments. Rehabilitation focuses on the existing capacities of the handicapped person and brings him to the optimum level of his or her functional ability by the combined and coordinated uses of medical, social, educational, and vocational measures. It is utilization of the existing capacities of the handicapped person by the combined and coordinated use of medical, social, educational, and vocational measures to the optimum level of his functional ability. It is not just the responsibility of a few NGOs or the government, but it is a collective responsibility of society consisting of able bodies individuals. Goals of rehabilitation: orientation, physical independence, mobility, occupational integration, social integration, economic self sufficiency. Rehabilitation may be medical, it treats patients using medical and paramedical skills to limit disability. Socio-vocational, it is sometimes delivered along with medical rehab and it limits handicap. Types of rehabilitation: medical rehabilitation, educational rehabilitation, vocational rehabilitation, social rehabilitation. Team members: medical, paramedical, play and drama therapist, socio-vocational. Physiatrist, medical, socio-vocational. Medical, orthotist, equipment manufacturing company, biomedical engineer, rehabilitation nurse, specialists in orthopedics, neurology and other specialists, occupational therapist, physiotherapist, speech therapist, prosthetist, socio-vocational, architect, special educator, clinical psychologist, placement officer, social worker, vocational evaluator and counselor, recreational therapist, government or voluntary agencies, skilled instructors. Physiatrist, social worker, placement officer, vocational counselor, clinical psychologist, special educator, occupational therapist, physiotherapist, other specialties, nurse, orthotist. Interaction between the rehabilitation team members. Rehabilitation approaches: institutional based rehabilitation, homes, daycare centers, outpatient clinics, camps, community based rehabilitation. Basic approaches in rehabilitation. Rehabilitation approaches: institutional based rehabilitation, outreach services, community based rehabilitation. Institution based rehabilitation and institution based rehabilitation, the focus of control is based in the institution. This service meets a small number of needs of a small number of disabled people. This is at best a limited approach, and at worst, it can abuse the rights of disabled persons. Characteristics: urban based, large number of rehabilitation personnel available, excellent infrastructure, referral center for all diseases and conditions. Advantages: research programs, statistics generated, rare conditions can be treated, rigorous program initiated and carried out by professionals. Disadvantages: prohibitively costly, patients are mostly admitted, hence they are cut off from society. No follow-up when patients are discharged. Outreach program. With outreach, the focus of control is still based as per the institution. More people can be reached, but there will be limits according to the distance from the institution, even according to whether the needs of the disabled people are similar to what the institution offers. Community-based rehabilitation, the focus of control should be with the community. So the opposite starting point in which the disabled people, family and community members decide what their priorities are and then work together with local organizations, government, institutions in order to access the relevant and appropriate services. Institutions have an important role as referral agencies. The difference is that they respond to needs rather than dictate them. characteristics: single contact with a large number of rehabilitation professionals at the same time. Many people can be evaluated on the spot, usually organized by a local organization for people from the lower strata of the society. Community based rehabilitation, institutional based rehabilitation. Community based on social model and human rights model, concept of capacity building and empowerment. Person with disability will be the decision taker. Utilization of available resources in their own community, targeted for larger population. Institution based medical rehabilitation based on medical model, concept of treatment, prescription. Professional is the decision taker. Utilization of professional service delivery model, target of smaller population. Community based rehabilitation, minimal medical service or basic services. Economic status of people with disability is not a barrier. Team member include person with disability, parents, caregivers, family, local community, NDGs, voluntary organizations, governments, change according to the cultural or context. Institution based rehabilitation, high tech medical services. Economic status is bigger barrier for getting the services. Team member include person with disability, physician, physiotherapist, speech therapist, orthotics, and prosthetic technician, music therapist. Change according to the medical condition.